just a little bit differently today with the masks on during this. Hopefully you don't get the distortion, but we're going to stay a little bit longer in this space with the folks who you're going to get introduced to in just a few moments. We'll take some time at the end for our press corps for questions of me or the members, but if there's any off topics, I'll be glad to stick around and take those. But we're gathering today, I think, and first of all, in appreciation the folks are here. You're going to hear stories from healthcare professionals. You're going to hear stories from people who have lost loved ones to COVID-19. You're going to hear stories from people who themselves have gone through what are called the long haul of this, where it's not over immediately, and then folks who deal with public health and how we're trying to implement these. The purpose in asking these folks to share their stories, which I'm grateful for, trust us with those stories, is I think to talk to Minnesotans when a public health crisis like COVID-19 has become so politicized, it's sometimes hard of where you get your information, and I think there's people that filter out certain information. And I think Commissioner Malcolm's note about when we talk in numbers and statistics and percentages and community spread as a percentage and infection rates per 100,000, those are important things to know, and they're important in how we make decisions. But they also take away that we're talking about an individual in every single situation. We're talking about a family member in every single situation. We're talking about a physician or a healthcare professional. So I wanted to take some time today. Again, a small percentage of people have yet been infected by COVID-19 and families impacted, but the ripple effects through the community on each of these stories shows you how devastating this can be if we don't get this right. So I'm grateful you're here. I think what I'd like to do is I'll start with Dr. Pham and maybe just start out to introduce yourself, kind of your experience around this a little bit, and then I will come back and we can go into maybe some greater details on some questions that I think, and then of course maybe the media here thinks is important to know. So Dr. Pham.
Thank you, Governor Walz. Thank you for having me here. I'm Dr. Khu Pham. I want to say I have multiple identities here. I'm actually a refugee from Vietnam, but I'm really a homegrown Minnesotan. So Minnesota is my love, really, honestly. And I'm proud to be here, part of this conversation. I'm a physician at the University of Minnesota, otherwise as M Health Fairview. I spend half my time there in the internal medicine wards, other half at Cook Clinic, which is a primary care clinic in South Minneapolis. Most of my patients there are immigrants, refugees, underserved, sometimes undocumented, and often without insurance. I also am board certified in addiction medicine, so I take care of people that often have addiction needs. Often they are unsheltered or homeless too. So I take care of a variety of different types of people. I've seen their struggles. I struggle with them on a daily basis. I think we've done a lot of pivoting, a lot of innovation in the first few months. And it's amazing to see. And honestly, there's this sense of collaboration that I haven't seen in a long time, and a lot of hope, particularly in the first few months as we kind of learned more about this virus. And I think it was also a time of gentleness for each other. I realized that I had to sit back and just start to listen to my leaders, my peers, my patients, and have a little patience with each other, and not to blame each other. Because this is an illness that just takes on you without you controlling it. It controls us, honestly. And so I've been really proud of my institution, my friends, my family. I've been affected in different ways. I haven't had a direct loved one die from COVID, but certainly I've seen my patients suffer through it. I've seen my family suffer through it in different ways because we have to contribute to the changes itself, too. So for instance, my parents have moved down to Florida last fall as they retired. I can't see them. And you know, as a Vietnamese American, we tend not to hug as much as most Minnesotans, but I've learned to hug so much, growing up here in this culture. I really miss their touch overall. But like everyone else, we've learned to pivot with that too, and we've learned to Zoom. So the first time my family is sitting together in Zoom, we're really all introverts. So it's really funny to watch us on Zoom together, because it's mostly us kind of smiling at each other most of the time. We have a little niece in the bunch that's 5 years old. She's the action of the party. So it's really fun to watch her. So those changes are amazing. But at the same time, I see the suffering when I'm doing telemedicine in my clinic, and I can't get a hold of my patient because they don't have Wi-Fi. They don't have a smartphone, or they don't have the tech literacy to get on the phone to communicate with me properly. But I think there's always a place of compromise, and that's what we're finding these days. I don't think we're doing the same thing that we did on day 1 or day 2, and that's important. And I think with you, Governor Walz, and the rest of the people here, that we've learned to change properly, and we've learned to listen to the community, but I think we can still do better. And I think we need to do these roundtable discussions as much as possible, and listen to the leaders of the community, because they all have different perspectives. And we can implement anything we want as leaders, but if the community is not able to do those regulations and policies, it's just not going to happen. So if I've learned more than anything is to meet my patients where they are and work together and listen to their barriers. Often that's silent and I don't understand. But it's all about gentleness and love for each other right now.
Thank you, Dr. Pham. Kathy, thank you, and I know your story's hard to tell, and once again, I'm grateful for you telling it.
My name is Kathy Hall, and I'm here first as daughter for my mother, Norma Hall. I took care of my mom in her years with Alzheimer's at our home for 5.5 years. And then last November, her care needs round the clock became more than we could do at home. And so made a transition to a care center, and a lovely place and wonderful care there. And we grew to trust and love them as they loved her, including having a time to take her out and come and visit and do different things for holidays. We had a beautiful birthday party for her in February, and had family and friends and people gather with her. And then in March, we went into lockdown suddenly. And I watched the decline as far as the disconnect for her, and just the disappearance of her in the midst of being with staff that are masked now. And as a retired nurse, she kind of understood it, but she lost connection, even with those care people. They worked so hard to still speak to her and use voice and connection and names. But as we could only do the virtual connections with her, you just watch the disappearance happening. In April, found that she was diagnosed with COVID, and at the end of April, we made the transition to hospice, and we were allowed to come and be with her and hold her hand, and that was important to me. I brought it with as my encouragement, but I'm actually going to share a picture of my mom because she's a person. And that this is her story, and that we lost time in that process. But we were with her for several days, and then said our goodbyes. Professionally, I work as a psychologist, and although I understand and can work with trauma, and I can work with complicated grief, to also then walk it at the same time, and the duality of that. So knowing it and doing it has been a challenge in the midst of our cultural pieces with COVID right now too, and the inability to come together and to gather and to provide support and encouragement and comfort. And so watching a community of people who love me, love us, work to provide support, and was talking about how I know that we have been blessed with many things in being able to walk this journey with my mom. And I am heartbroken as we watch the staff say goodbye to one more person that they loved. And I'm heartbroken for other people that I know and whose journeys I walk with, when they didn't get to say goodbye and they didn't get to stand or be with that person because of the limitations. And so the journeys continue. The layers and layers and layers are ongoing. And before my mother was sick, described COVID as the invisible tiger. And the difficulty being that you couldn't see it, and you even didn't know when you were bit. So knowing that one of our challenges was deciding to go and be with my mom, and knowing what the risk was with that, and grateful that we were able to come through that safely. But they're horrendous choices that people are having to make in the midst of this very complicated situation.
Thank you, Kathy. Again, thank you for trusting us with your story. Nashito?
Hi, good morning, everyone, and thanks so much, my friend Walz. Thanks so much, Governor, for inviting me and to all of you. My name is Nashito Herrera. I am originally from Cuba. I get my PhD, so like a doctoral degree in piano and in orchestra conductor back at the University of Music in Havana, a few years ago. And in 1996, I came to this wonderful country for the first time, and you won't believe what I'm going to say, but the first stage I ever performed in the United States was at the Old Way Theater in St. Paul, Minnesota. So since that, I definitely get in love, with the whole country and specifically with this wonderful state. In 2001, I decided to stay in the United States, specifically here in Minnesota. After work for almost 2 years, really hard with different immigration attorneys, I was able actually to bring my family from Cuba too, which my wife is with me today. And has been a long journey, has been wonderful, blessing time here, seeing my kids growing and going to different schools, to like public and even to private schools. I'm seeing them growing and now I even have a family. I am a grandpa of 8 grandkids right now. And back in March, on March 28th, I was supposed to perform another solo piano performance at the Dakota Jazz Club, which everybody's familiar with this wonderful club. We had the privilege to have it in Minnesota. And the same day, at almost 12 in the afternoon, that's something even my doctors and my wife and daughter told me, because I was completely unconscious by that time. I didn't even know, believe it or not, the word rooms were in my house. So even simple like going from the living room to the bathroom, I didn't know where it was. So that was kind of like the start to be. My wife and my daughter, Medalis, which she actually served for almost 5 years at Minnesota National Guard, which I'm so proud of her too. They decided to take me to the St. John Hospital because I live in White Bear Lake. And right there, 2 of the doctors were working in that day. They started to check me. I get into the hospital, according to what they said, with just 35% of oxygen. So my daughter said, like, even I was talking to the doctor, which I can't even remember that. And he told her, he's in the bad shape, we need to actually proceed and intubate as soon as possible. And it looks like they did it on the right time, because right after that, they intubate me. My daughter said like she heard the sound of beep, so it looked like it was the very first time. My body was kind of like fighting and I'm saying goodbye to the earth. Right there, they considered like I was in the really, really, really bad shape, and they contact the team of the doctors at the Fairview Hospital of the University of Minnesota, specifically Dr. Melissa Granswell, which she is the director of the ECMO program in Minnesota. We have to feel blessed and very lucky we have this system here in the Twin Cities. It is an amazing machine. They connect you. It is a kind of like an artificial lung. So they have to connect to different tubes, as you can see right here, through the neck to help and clean all the bad blood you have in your lungs. It is a really long process. And I was there connected to the ECMO program for 12 days. But unfortunately, I got the really bad side of COVID-19, to say it in some way, because it wasn't just the lungs. Right on the 48 hours later, according to what they said, actually my heart would start to failure too, so she had to contact another specialist in heart to connect me to the bypass, so they have to make a big incision right here by my right leg to connect the whole cables. Right after, when they get the heart in kind of control, my kidneys start to failure too, so that it was the whole entire, to say it in some way, was the whole entire package of this huge, invisible enemy trying to kill myself, trying to kill my body. Thanks to the whole doctors at the University of Minnesota, and definitely thanks to the wonderful collaboration they start to make in between them, and thanks to the whole support I even get from the office of Senator Tina Smith and Amy Klobuchar. They contact the Cuban embassy in Washington, D.C., and my dear friend, Mr. Jose Ramon Cabañas, our Cuban ambassador, was able to contact a group of doctors in Cuba, my first country, and I'm sorry, my voice started to get kind of, because it is kind of hard. And based in this whole situation, the only way they were able to connect was virtual, or sometimes even by phone. But what's great, because they make a two group of wonderful doctors in there at the immunology center with Dr. Tanya Crombet. They start to share information, because as everybody knows, this is completely new stuff. Not even the doctors knew exactly what they were dealing with. So thanks to all of them, they start to work really hard, and after 14 days in coma, I had an iPad, which my family was able to talk to me every day. I was one of my grandson when he looks like a God put him on the journey or the position to wake me up, and he was the one like yell at me and said, because they don't call me grandpa, they call me papi. So, and he said, Papi, you had to wake up now. Like he was definitely yelling and screaming at us when I opened the eyes, and I, for the first time, I saw myself connecting to so many tubes and cables, and so for somebody left home practicing Rachmaninoff's second piano concerto to play with the Waisera Symphony Orchestra, for somebody who was just getting ready to perform a solo piano performance at the Dakota Jazz Club, wake up after 14 days with completely no strength in the finger, no control in your hands to even bring the food to your mouth. I remember getting some mashed potatoes and all my hands were shaking, and part of the food would just drop it in the floor, and every single minute I was saying to the whole person I work at the University of Minnesota, I said, I'm so sorry, but I have no control on do this or this or that. So I'm sorry, Mr. Governor, for taking a little bit longer time, but I want to share the history because it is no doubt, and I want to be completely clear and specific. Please, my dear friends, it is no doubt the COVID exists. We have to deal with this big, huge enemy. And we are still dealing with that. And I think the only way we can continue to win the battle is working together. It is definitely, we need to stop to blaming, because that's not the way. We cannot continue to blame to the governor or to the government or to anything. It is just the way we take this as a big experience about what we have been doing, knowing like this is completely new for the governor, for the doctors, for us, for everyone. And then what we should do, because one important thing is now we need to work with this to finally win the battle, which we will. That's no doubt. I have no doubt, like we are almost towards the end. We are listening lots of great news about the different laboratories creating the vaccinations, including Cuba, my country, which hopefully sometimes we can actually be able to invite some of our wonderful doctors there to work with the marvelous doctor team in Minnesota, as they are doing already in Washington, D.C., in New York, and even right here next door in Chicago. But we need to get ready for the next one, because this is not going to stop now. So I really appreciated the opportunity, my friend, the governor, that all of you have given to me to explain to all of you, like, this is real. And the prevention plan, what he has been doing, is the most important thing. Yeah, we can blame him, because I say, well, I am concerned about if places keep getting closed and closed, we are self-employer. If I don't play my concerts, I don't make money. But sometimes you have to put things that on the side, because the most important thing right now is control the numbers, because my dear friend, the commissioner, was saying something is really important. We cannot continue to talk about numbers, because each number is increased, has a name and last name in there. And that's what we need to get focused. In not to add no one more number. No, it is in no to add one more name and last name to that more than 200,000 name and last name of that list. And here I am, your friend, Nachito Herrera, which I commit, volunteer, my dear friends, for you from now to keep this big, huge campaign and do whatever we need to do to keep saving life.
Thank you, Nachito.
Thank you.
Thank you, Nachito. Are you playing again?
I already play, and I am planning to keep playing, my dear friend.
Good. Well, thank you again. Dr. Cole, you are at an intersection of many of the things that COVID is bringing, so your story is interesting in that it's where a lot of us are at with home for family, but your side of things of also seeing what COVID does, so please.
Sure. Thank you, Governor Walz, Commissioner Malcolm, and thank you for inviting me here today. I feel honored to be among all of these incredible people. My name is John Cole. I'm an emergency physician at Hennepin Healthcare. By pure coincidence, I also happen to be the medical director of the Minnesota Poison Control System, and that weaves its way back into my story later in a kind of a strange way. I work at a safety net hospital, and I'm extremely proud to work there. We have the privilege of serving all of Minnesota, but especially a population that is sometimes underserved and under-resourced. I have a strange connection to COVID-19 in that as the world seemed to be changing in the second week of March, my family, my wife and our 4 kids, had planned to travel to Florida for spring break and to leave on the Friday morning, March 13th. It was a trip we had been planning for almost 2 years. We were traveling with several family members, some of whom were elderly and have some underlying medical conditions. And because the virus had clearly started to get out of control, we made the decision to cancel our trip and stay at home. And as difficult as that was, I have never been more glad in my entire life that we made that decision, because 5 days later, my wife started to get sick and had fever, rigors, felt awful, was quite ill. And shortly thereafter, I fell ill as well. And then over the next 2 days, we watched as each of our 4 children also became ill. We quarantined. I promised, Commissioner, I answered every phone call from the health department. We lived our course with the disease. It was an incredibly bizarre and surreal experience. It was very difficult. Personally, I remember my body aching so much in the morning that I couldn't even get out of bed without just some ibuprofen and some Tylenol to just get around and move and try to go about the job of taking care of our 4 kids. I've never felt so short of breath in my life, to the point where at one point I asked one of my partners from the emergency department to drop a pulse oximeter at my house because I was so concerned that I was starting to get hypoxic. And that one little act of kindness that my partner did for me makes me think so much about the health disparities between the way that I lived this disease and the way that I saw it manifest in my patients when I was fortunate enough to come back to work. We have so many resources, right? We're otherwise well, and yes, it was extremely challenging to take care of 4 kids while we were all sick with COVID-19, but we managed to make it through. It was terribly difficult. And I think so much about how hard it was for us and how much easier we have it than all the patients that I take care of. And when I work in the emergency department and I see patients who come in who live in multi-generational housing and have food scarcity and have unstable housing situations and have to make decisions about whether or not they're going to go to work so that they can pay the rent and find food just to be able to continue to exist, and balancing the possible exposures that they have. We're lucky. We could socially distance. And I'm so glad we did. I mean, I think of all those people, our relatives, all the people on the plane, the tens of thousands of people at the resort we were going to go to that we would have exposed had we not gone. Not everybody has the luxury of doing that and making sure that they still have a place to live and resources to live with. And that just, every time I go in for a shift, that just is so real. And I think too about how the disease has affected my job at work. It's so hard to communicate, especially during a complex resuscitation with all the layers of PPE that we use and how we have to speak slower and clearer and louder. And I think about the families that I have to give terrible news to and how they can't see my face and I can't make that human connection with them on what is almost certainly the worst day of their life. And I think of how much that's robbed, how we've all been robbed by that. And it makes the job harder. I also, in my job in poison control, am faced with decisions that I never thought that we would have to worry about. Part of what we're so grateful for at Poison Center is that with the right information, about 90% of the time we can keep you safely at home, but about 1 in 10 times when a Minnesotan calls us, we have to send them to a hospital. And now the risk-benefit ratio of that has changed substantially, not just for the person who needs to go and have their poisoning emergency evaluated, but for the family who has to go with them, for parents who have to take their children to a hospital and go out into public when that wasn't a risk before. I think about the phone calls that we get related to all of the possible and proposed treatments, and how we received a phone call once after a somewhat infamous press conference from someone asking about a safe way to inject bleach into their body, and how important it is for us to make sure that we get good facts and good information to everybody to keep everybody safe. And I think about the fact that hand sanitizer has become omnipresent in our lives, and the manufacture of it has become unsafe to the point where there is now substantial methanol poisoning that's occurred in our poison center catchment area, including 2 people who died of methanol poisoning because of their exposure to hand sanitizer, which, to be clear, to make sure that everybody feels safe using hand sanitizer, was 2 unfortunate cases of people with alcohol use disorder who consumed hand sanitizer because that was the only resource available to them, which is normally not nearly so toxic. And all of these problems are all things that directly derive back to the virus. I'm extremely grateful to have my health back. It took me weeks to feel normal again. I was able to go back to work after about a little over 2 weeks. People in my family who've had it have described that they still feel short of breath weeks later and months later, and I certainly felt that way too. I feel incredibly lucky to get to work at a place like Hennepin Healthcare, and I'll leave it at that. That's my story.
Well, thank you, Dr. Cole, for sharing your story, and thank you for the empathy. I think in this, that's a piece of it. I can't note enough how fatigued everyone is by this. With your story in March and Nashito, I remind folks that Lieutenant Governor Flanagan lost her brother Ron to COVID back in March when we didn't even really know what it was. She never got a chance to see him. They still have not had a proper ceremony. And we talk about the last 6 months, how it's worn on everyone, that people are tired of it, and they just want it to go away. And I think all of us do, but wanting and wishing for something to happen does not make it a reality. And I think that is a really hard part. So I appreciate your empathy on those folks who come in front of you. Our next guest here, Amy Westbrook, is the Public Health Director and Human Services Director in St. Louis County, who is, I guess, responsible for the intersection of some of these policies and the reality of where COVID-19 hits the public. So, Amy, thank you for coming and sharing.
Yeah. Thank you, Governor Walz and Commissioner Malcolm, for the opportunity to not only hear about St. Louis County, but inviting the local public health, me as a representative from the local public health system in Minnesota. And my heart goes out to everyone who has been impacted dramatically from COVID-19, and also to the physicians who are helping on those front lines. It's definitely a community response that we're dealing with here. Just a little bit of background. I'm the Public Health Division Director for St. Louis County. I've been in my job for about 6 years now. And St. Louis County is a very large geographic county. We're the largest county east of the Mississippi, and we're a border county. We go all the way from our southern area of Duluth all the way up to Ely. So we have rural and urban communities across St. Louis County with very different community needs. September has been a very difficult month in terms of community transmission for us in St. Louis County. We've seen just about 50% of our cases. We're probably close to 1,400 cases now in St. Louis County. About half of those have been reported in September because of our increase in community transmission. And we've also seen about 50% of our deaths in St. Louis County reported in September. And that's primarily because community transmission is now pervading into our long-term care facilities. So dramatically, our long-term care facilities are really being hard hit by this virus because of the transmission we're seeing in our community. The planning and response is always local, and your local public health system is working just tirelessly, relentlessly, with such dedication in partnership with the Minnesota Department of Health, in partnership with healthcare, and really so many different partnerships across our community. We know it's a public health crisis, but it's certainly not just a public health response. It impacts every aspect of our community. We really want people to have that social interaction, but we are seeing people be more complacent with community gatherings and social interactions. We want people to have that social interaction, but we certainly want people to do it safely. And we really want to encourage people to follow the Minnesota Department of Health guidelines, the Centers for Disease Control and Prevention guidelines, the governor, your orders. Those are just critical because as we see community transmission increase, what we have is our health behaviors and what we have is each other to combat it. We're really working at expanding testing, at promoting availability and accessibility of testing, and working with key community partners in getting information out, promoting resources and education, and really leading that community response for COVID-19, taking a very data-driven approach, really assuring that partners know our localized data and what's going on in our specific communities. So I'm happy to be here, and I'm happy to speak on behalf of the Greater Minnesota and local public health, so thank you.
Well, thank you, Amy. I think I'll let our guests in the media maybe ask some questions, but I asked you to come to tell your story because the public, I included with them, the fatigue of this, and if you've been lucky enough that it haven't touched you, people are asking, why can't we gather on Friday nights at football games and pack the stadiums and do tailgating? Why can't we celebrate weddings in this beautiful fall weather? Why can't we open up bars and restaurants and watch the Vikings on Sunday afternoon in a sports bar? Those are things all of us want to do, the other things, and just the hugging your parents. And same way, my mom just had a procedure at the Mayo Clinic and I can't see her. I have not seen her since March. And all of us are feeling that, but the question I get asked a lot is, Governor, when are you going to take the mask mandate off? When are you going to open up bars? And my response seems to fall somewhat flat when I say, the virus dictates when we're going to do this, and our response to the virus is going to dictate how quickly that gets done. So one of the decisions I have to make is we're trying to strike that proper balance. But what I recognize is if we get it wrong, someone goes through what Nashida went through. Someone goes through what Kathy went through, Dr. Cole, or I put Dr. Pham, Amy, the commissioner, in positions where we put our healthcare workers at risk. So I think the biggest thing is telling folks we've learned a lot. And I think the physicians would tell you that what we learned from what happened to Nashida might look different in how we treat that today. We have new therapeutics, but not everyone, as Dr. Cole said, is going to have access to those therapeutics in the same manner. And no one, maybe a lot of those folks, aren't going to have that luxury of continuing to shelter at home because the assistance to allow them to stay home is coming to an end. And putting things in place like eviction moratoriums is the only thing standing between people being forced back into a situation where they may get sick or they may lose their home. So I think we're at a point 6 months in, bringing it back and grounding it in people, grounding it in back of what we've known, continuing to be innovative and think the way we solve this. But I wanted to put faces to that. Again, thank you. Thanks for trusting that. And I think I would turn it over and see if there's some questions from the folks here.
Governor, can I just follow up? You said people ask you to tell people expect to have all winter, 3 months.
Yeah, I wished I knew the answer to that. I am hopeful, and I think I'm an optimistic person, but I want to be very careful in this job of giving accurate data as we see it. But I think there are indications that from therapeutics and potentially vaccines that we're moving, I certainly, and I think Commissioner Malcolm would agree, we certainly think that there are months to go in this, and I think stating it that way. But I hope, and the thing that I keep trying to get across is the decisions that we make on public health of how we're going to how long this has lasted. The United States has not handled this correctly, and here we sat, the most infected nation, the most deaths, and the slowest to recover from it. There are things that you can do. The virus is going to do what it's going to do, but our behaviors can impact that. And I keep telling folks, we have got to squash this thing out. But I recognize, and I hear this a lot, well, they're not doing it in Wisconsin. I know they're not, and that's why they have 8,000 cases today. And that's not a pejorative towards them. It's just simply a choice that was made. And so I don't anticipate, again, as I told in March, and from a purely political perspective, giving bad news is not a good thing necessarily, but giving the truth and informing people is what was required of me. And I said in March it was going to be a long, dark winter. We're still in that long, dark winter. Yeah. On which tweet was it? I can't keep track of them.
What were you
I'll let folks who've been through this, and I want to just be clear, our goal is never to scare people or to put fear. It's to provide factual information and things that they can do to protect themselves and their family. But I would never tell my children to be fearful of crossing a street, but to be very cautious, and there's a right way to do it, and then you can do that. And I think this idea of how, be reckless in this. Maybe I'll just turn it to the folks. Some have been through this on that. I know it. I know the Lieutenant Governor and I spoke about this, and she was pretty angry about the idea of this because her brother, a Marine, and fought this thing but lost his life to it. That somehow he was afraid or somehow he didn't fight hard enough was really disrespectful, and I know she wanted that conveyed. But yeah.
I think is just the matter of fact of for how long we will need to use the mask. It is actually the matter of fact of constantly know this virus exists, and the most we work together, I think it is going to be the shortest time we will be forced to use the mask. In my own opinion, I want to say that I am 100% disappointed on the way the president has been point this situation with the COVID, because we completely understand, and I want to remind all of you, I am an immigrant, and I am so proud to have, I think I am one of the few people who have just 3 citizenship, Cuban, an American, and Minnesotan. So I am so proud of the way the governor have been taking this situation, and so disappointing the way he is doing, the president is doing it, because he completely needs to understand he is the face of all of us. So he's supposed to be the leader, or we are supposed to follow to continue to do things, fighting against this invisible enemy. So it is, like I said, it is just a matter of fact to continue to understanding, like, we have to work together, dear friends. This is the only way we are going to reduce the time, because the safe we are, we need to continue to think about, if I use my mask, I am saving my life, but at the same time, I am helping to save the governor's life and my wife's life, because they are just next to me right now. It is comfortable, and O means no in Spanish and English. It's not comfortable where it is all the time. Even last week, I have to do my first live performance, and I had to take it out because I couldn't even breathe. I tried to do it at the first time, but it was completely impossible to do it. But it's just the way we get on the point of the direction, like giving more time to the people working in health, the specialists, what I call angels under the white clothes, to give them enough time to continue to develop the right vaccination, which today I say in front of all of you, I will be the one to get it, because I want to continue to save life. Thank you.
Other questions? Commissioner, that's MDH's space about contact tracing and thing on the events in up in.
Understanding your question, so it's, I heard two things. Are we wanting to take action, any sort of action against the failure to comply with the governor's executive orders? That was one question, right? And then second, what do we need from health officials in the DC area, and what do we need from the White House to help us do whatever contact tracing we need to do here in Minnesota? So did I hear both of those questions right? In terms of I think the governor sent a very clear letter to both campaigns expressing what the standards are in Minnesota and hoping that they would partner with us in adhering to those. And, certainly we're, nothing much to be done about that in retrospect, I think, other than to have been clear what our hopes were. In terms of the contact tracing, we are typically we rely on the local public health agency or the state agency of jurisdiction to give us the information if they've identified transmission. We are actually we're talking right now about whether, in this case, we would like to not just wait for them to do that, but to tell them that we need and expect a higher level of information. I think those questions of like how strict of an enforcement posture do we want to take before events happen is something that we continue to evaluate. I mean, we just keep on trying to reinforce with folks who are planning events what the standards are and why we strongly recommend that they not do it or that they do it under certain protective measures. But I don't know, Governor.
Yeah, I would hope they'd follow. I hadn't heard that yet. I would say that sure sounds like the proverbial cart in front of the horse, but MDH will enforce policies as they do equally. Again, we find no pleasure in this. I wish we didn't have to do it. I wish this would all go away. I wish they could gather in a ballroom and pack close together. But if you do that, as Nashida said, you're not just risking your own health, you're risking everyone else's health. This is not all that complicated, that we're all in this together, and public health professionals are there to help everyone else, regardless if that was a meningitis outbreak in a high school or, in this case, a new novel coronavirus. So I would hope they would follow. It just seems odd to be planning that right now, but we're in the middle of this thing and we'll keep fighting it.
do you have any sense of it's too early? Part of that, makes sense.
I don't actually have any data at my fingertips to be able to answer that in any quantified way. It's certainly, we look for patterns, we look for correlations with events and changes. Amy, I don't know if you have anything you'd like to add.
No, it is pretty early still. The large event was on Wednesday evening, and we're encouraging people to certainly be tested if they have symptoms, and then also to consider getting tested 5 to 7 days after the event, which would be, yesterday, today, tomorrow, and we'll be, I'm guessing we'll be having more data come if we do see cases associated with the rally the next few days.
My public service announcement, if I could, on that, we have the lab that's open now in Duluth for walk-in testing. I got the feedback from Mayor Larson that is working. Amy had asked, and then we'll go to the follow-up, if that lab makes it pretty easy for folks to get in there and get tested.
Yeah, we have a saliva testing lab that's been open with a partnership between the state EOC and Vault Labs, and public health is really appreciative. The community is appreciative. It's another way for people to be tested if there are health insurance barriers, if there are transportation barriers, cost, if people aren't interested in going to a clinical setting. So it will increase our testing capacity in Northeast Minnesota, and especially Duluth. So that's a great resource that we have now to assure that testing is more available and more accessible. Well, the saliva testing lab itself is not operational on Monday and Tuesday. So the numbers over the weekend, as far as I know, were normal. We've been seeing about 400 to 500. It's only been open for about a week and a half. About 400 to 500 tests run from the site itself. Wednesday was our highest day. I believe close to 1,000 people were tested last Wednesday. Let's see, I was going to say something else. I can't remember.
We definitely are concerned about that. We see that in a number of ways, in a number of settings. We see people looking for healthcare professionals who will give them other advice or permission to take a different course of action. We see people wanting to avoid testing because they don't want to know the answer, because they don't want to then have to deal with quarantine. We see those dynamics around people not wanting, and in some unfortunate cases, being discouraged from accessing testing when it is available because their community is afraid of seeing higher numbers and whatever implications that may have for sports or schools or whatever. So we understand, that that people are concerned about the consequences, but as so many of the folks here this morning have said, these are the only ways we're going to be able to work together to keep this under control and to save lives and to keep on moving back toward more normalcy. Although I think the new normal is something we're going to have to continue to live with for a while, to your earlier question, Mary. But I think we appreciate the medical association's help in getting that word out to folks. So I don't know if either of the physicians has a comment.
Yeah, I guess I would add that we live in a world of so much information overload, a lot of misinformation, disinformation, and a lot of wishing. And we also live in a world where science doesn't move that quickly. So the research we're learning about this novel coronavirus, it's only been 6 months or so. And so our reaction has to be conservative, because I'm thinking about the most vulnerable people in our population. I'm gonna wear this mask as a community member until I know that the most vulnerable people are gonna be protected, whether we have a mandate or not. So when we talk about quarantine or social distancing, I'm thinking about my fellow person next to me more than anything else, too. And I do that with my patients on a daily basis, too. So, I know our patients have barriers on a consistent basis. So people break quarantine, not because they want to. It's not because they don't want to protect their fellow person next to them, but it's those driving forces of their safety nets that have been taken away. They can't get to work. They can't pay their mortgage. They're losing their loved ones around them, maybe not from COVID, but from economical forces. So I think that's where we sit down, we talk to each other, and it's like, why do you want to break quarantine? How can I help you stay in quarantine? How can the government help you? How can your family help you? How can the community help you?
I would segue that to, that is the exact reason that we need the United States Congress to pass a stimulus act that provides that help so people can stay home and that businesses can continue to survive and do what they need to do. Every other nation in the world did that. Every economist across the political spectrum agrees that if we're going to save the economy, the way to do it is to do a stimulus, and we simultaneously get the health benefits out of keeping people out of circulation. So I made the mistake of getting my hopes up a little bit before last evening, because it sounded like talks between Speaker Pelosi and Secretary Mnuchin were moving. National Governors Association sent a letter of all the governors in agreement that needed to be done, and here we sat. So I think we're running a little short on time. We'll take another follow-up. Yeah, we can do some off topics. If we're done with these folks, I'll take them to me. You have one more on this?
Well, we do continue to post specific data on the MDH website every day, and every week we do a bit of a deeper dive on how incidence rates differ across racial groups, how severity of illness, hospitalizations, severe hospitalizations and deaths do differ across population Minnesota. I'm happy to say we're not particularly seeing the disparities widen, but nor are we seeing them close. I mean, they are, as I think several of these folks have said very eloquently, COVID is just continuing to shine a light on something we already knew existed. All these systemic challenges that some populations have that predispose them to more exposure and make it harder for them to get the access to the resources that they need. So it's not a behavioral thing, it's really a structural thing, that what is producing these disparities.
And I would just add to the commissioners, that's exactly right, and some of the things you're talking about is we know that they're manifesting themselves in educational disparities that were already grossly apparent and getting worse. Focusing this afternoon, I'll be having a meeting with Lewis King and some of the things that outside groups are doing to try and make sure that we're closing and providing tutoring, and in many cases that broadband access and the actual devices they need. But that extends across all of the agencies of already looking at the equity issue and those systemic gaps, but now COVID just exacerbated that. So asking each agency to figure that out. And I think one of the things is, like Commissioner Malcolm said, being very intentional on disaggregating that data so we could see exactly what this was doing. So off topic, yeah.
So the election budget, we're not on the ballot, but barring is supposed to have visible positive, negative, opportunity for minutes. What extent do you expect the election first referendum on what you've been able to do, how important it is to the winning practice in terms of delivering on your
Yeah, my job as governor, as I said, certainly if it were about politics, closing all the businesses in the state isn't a necessarily great political move, but it's the move that the Minnesotans entrusted me to do. I think that we have used data, we have learned, we've innovated, we've grown, we've corrected things when we think we've gone down the wrong path, and I think we've put Minnesota in a position to avoid some of these incidents like you saw with Nashito or what's happening with Kathy. So I do think this election will be. It certainly is going to be a mandate. The one thing is there's a distinct contrast between how the president has handled this and how the states have handled it. I have simply said all along that I want folks in the legislature who want to work with me and compromise to find solutions. So I think Minnesotans will be thinking about that. I think they're going to be thinking about, why can't we get a bonding bill done? Why do we have time to complain about the governor's mask mandate, but we can't get a bonding bill done that's agreed to? So I think those legislators all run on their own records. But I think Minnesotans are going to step back and look and decide if being able to get along. I'm not giving up, even though some of you've asked the question. It is hard, and it may be further than when I started, but it doesn't mean I can turn away from it. We've got to find a way to unify the state. That one Minnesota wasn't a campaign slogan. It was a core value that I think a lot of us share, that we're stronger together. And I think coming to that, if you want to see some unity, if you want to see compromise to get things done, if you want to see a politics that's about a hopefulness for the future, I think they've got a choice on the ballot. And again, this is my first experience in 16 years where I'm not in an election cycle, but I am out there. I will be calling the legislature back on Monday. I think there's a chance, and I've been speaking with the legislative leaders. I spoke last evening with Senators Kent and Senator Gazelka. I felt it was a productive conversation. I think certainly the Senate, I think, has made a good faith effort to get a good bonding bill done. We know that it's stimulus. We know that it's job creation. We know that it works across the state. I have not spoken to Leader Doubt, which seems to be where the sticking point is, but my hope is that there is a little, I think there's reasons to be somewhat hopeful for Monday. We'll see on that, but I'm prepared to sign that. I'm prepared to help compromise to get that done. And so, I think that would be good for Minnesotans. I think if you need a boost in a time where we don't get a lot of good news, come back Monday, let's work together on fighting COVID, let's pass a bonding bill, and then you could go out and campaign. We'll come back in November. I think so. I don't want to say never, but it seems like one way or another, the legislature for 2021 will be reset after November 3rd. There may be some folks calculating that if they waited till then, they can get a better deal. I think that's the kind of stuff that frustrates Minnesotans. This deal, we've waited 2 years where we haven't had this. We've had ample opportunities to pass this. It's universally agreed, whether you talk to county commissioners or mayors, it probably has a 90 to 95% positivity rating. Most legislators are for it. The Senate Republicans could help pass one, so I think there's reasons to be somewhat hopeful, but if it doesn't happen now, probably not. All right, thank you all. Thank you to each of you.
Thank you, Governor. Thank you.